Welcome to section 19 of metabolism. In this section, we'll be discussing lysosomal storage diseases. Let's get started. Lysosomes are organelles within cells that contain enzymes used for breaking down obsolete components of the cell. Lysosomal storage diseases are due to an absence of lysosomal enzymes, which normally metabolize molecules called sphingolipids. Sphingolipids are simply a class of lipids that are commonly associated with nervous tissue, so defects in their metabolism will often result in neurological symptoms. This table can be found in section 19 of metabolism and provides an overview of the lysosomal storage diseases. Many of the enzymes and substrates contain long and complicated words which can make the lysosomal storage diseases difficult to memorize. It can also be hard to memorize because the enzymes and substrates don't easily tie into any of the metabolic pathways we've discussed. For these reasons, I believe it's easiest to remember these diseases using a few mnemonics combined with this table. Okay, one more point before we dive into the details. The top 3 diseases right here are by far the most high yield, so we'll spend the majority of the time discussing these. If you can memorize these 3 diseases, you'll be well on your way to getting most of the questions about lysosomal storage diseases correct. Let's start with Fabry disease. Fabry disease is due to a deficiency of alpha-galactosidase A, which results in an accumulation of ceramide trihexoside. The accumulation of ceramide trihexoside is particularly prominent in the arteries and nerves, which is responsible for many of the symptoms. As ceramide trihexoside accumulates in the nerves, it results in neuropathy of the palms and soles. Accumulation in the autonomic nerves causes dysfunction of the sweat response, so there is decreased sweating. Accumulation in the arteries results in renal and cardiac ischemia, which puts these individuals at an increased risk of developing renal and cardiovascular failure in adulthood. Accumulation in the vascular system also results in angiokeratomas, which are benign vascular skin lesions. Finally, notice that this is the only lysosomal storage disease on our table that is X-linked recessive, while the rest are autosomal recessive. Now notice the mnemonic right here. I used the A sound in Fabry disease to help me remember that the deficient enzyme and the accumulated substrate both have A sounds in them. Notice how many A sounds are in alpha-galactosidase A. Also notice that ceramide has the letter A right in the middle of the word. The A also helps me remember that the toxic compound accumulates in the autonomic nerves and the arteries. So A for autonomic and arteries. Finally, the A helps me remember angiokeratomas. Niemann-Pick disease and Tay-Sachs are almost always tested together because they both can present with a cherry red spot. On the left, you can see a normal fundoscopic exam. On the right, you can see a cherry red spot. Both of these figures can be found in section 19 of metabolism. A cherry red spot is most commonly seen in patients who've had a stroke resulting in an occlusion of the central retinal artery. From anatomy, you should know that this part of the eye right here is called the macula. In the figure on the right, notice that the macula right here appears much brighter compared to the surrounding region right here. This is because the central retinal artery, CRA, supplies blood to the surrounding region of the macula. So when it's occluded, less blood reaches this area. On the other hand, the macula itself receives blood from the choroid, so it's unaffected when the central retinal artery blood supply is compromised. This is why the macula appears bright red, hence the name cherry red spot. Okay, so both Niemann-Pick disease and Tay-Sachs disease can cause a cherry red spot. So how do we distinguish them? Notice that from the findings column that hepatosplenomegaly is the only other clinical manifestation that distinguishes the two. This is incredibly important. If you have a question with a cherry red spot, you need to look for clues about hepatosplenomegaly in order to get these questions right. There are some pathological findings that you can see from the table that'll help distinguish the disorders, such as foam cells in Niemann-Pick disease or lysosomes with onion skin in Tay-Sachs disease. However, hepatosplenomegaly is probably the most high yield. The mnemonic, "No man picks his nose with his finger," is helpful in remembering that sphingomyelinase is the deficient enzyme and that sphingomyelin is the accumulated substrate. For Tay-Sachs disease, the mnemonic Tay-Sachs lacks hexosaminidase is helpful. Notice that the X in Tay-Sachs can be used to remember that hexosaminidase A is the deficient enzyme. Also, the M in hexosaminidase helps me remember the M in GM2 ganglioside, which is the accumulated substrate. Okay, let's do a question. A 20-year-old male presents to the physician for recent onset polyuria and polydipsia. Labs are significant for proteinuria and an elevated creatinine. Further investigation reveals a deficiency of an enzyme normally present in lysosomes. What other symptoms would likely accompany the disorder described in this vignette? Hopefully from the question stem you notice that this patient has signs and symptoms consistent with renal failure. These include polyuria, polydipsia, proteinuria, and an elevated creatinine. We're told that this is due to a lysosomal storage disease and asked what other symptoms would likely be present. From the summary table, recall that Fabry disease is the only lysosomal storage disease that results in renal failure. So other symptoms that would accompany Fabry disease include palm and sole neuropathy, decreased sweat, cardiovascular failure, and angiokeratomas. Okay, what we've covered so far is by far the most important information to remember for your test. I'll give you one more mnemonic for Gaucher disease, and then I think it's most helpful to just memorize the last two lysosomal storage diseases. I use the U in Gaucher disease to help me remember that the deficient enzyme is glucocerebroside. You can see the U in glucocerebroside right here. Contrast that with galactocerebrosidase in Crab disease. The accumulated substrate is glucocerebroside, which also has a U in the word. Gaucher disease is unique because it causes bone disease. This includes osteoporosis, bone crises, and aseptic necrosis of the femur. It can also cause pancytopenia, hepatosplenomegaly, and lipid-laden macrophages. This can be easily confused with leukemia, so pay special attention to the symptoms and the histology. I'm not going to read the information on the table to you regarding Crab disease and metachromatic leukodystrophy, but you have that information in front of you, so you can memorize that if you'd like. Okay, with this in mind, let's do another question. A 16-month-old boy is brought to the physician for developmental delay. His parents are a young Ashkenazi Jewish couple who state that he is still unable to walk or crawl. Physical exam reveals hypotonia, hepatosplenomegaly, and a cherry red spot on fundoscopic exam. A deficiency of what enzyme is most likely the cause of this patient's disease? Hopefully from the question stem you notice that this boy has signs and symptoms consistent with Niemann-Pick disease. These include weakness resulting in impaired walking and crawling. He also has hepatosplenomegaly and a cherry red spot. You should also know that Tay-Sachs, Niemann-Pick, and some forms of Gaucher disease have an increased incidence among the Ashkenazi Jewish population. Remember from the summary table that Niemann-Pick disease can be distinguished from Tay-Sachs disease by hepatosplenomegaly, which our patient had. In this case, we're asked what enzyme is deficient. From the table, we can see that a deficiency of sphingomyelinase would result in Niemann-Pick disease.